Hello and welcome to today's self-directed ST3 teaching session, which is entitled Recovery, the Art of Convalescence and the Role of the GP. And quite a significant part of today's session is based on a really rather wonderful book by Gavin Francis, which I will put a bit more information about in the handout that you're getting. This is the book. I'm just going to stop sharing that so I can share this, show you. This is the book, Recovery, the Lost Art of Convalescence by Gavin Francis. You'll see it's a teeny tiny book. Mine's a bit battered because I've looked at it a lot, and it's a really wonderful book. And if you're looking for something to read, I really would thoroughly recommend it. But before we get on to that, I want you to just think about a case. So Eleanor is 36. She lives with her husband, Jake, and her 5-year-old from a previous relationship, Lucas. She works as a self-employed landscape gardener. She presents to you one morning with severe left-sided pelvic pain. She has an acute abdomen. You admit her to hospital, and she has an ultrasound scan, which shows that she's got ovarian torsion. She ends up having a failed laparoscopic oophorectomy, which ends up being converted to laparotomy after the exhausted gynecology registrar inadvertently perforates her bladder during the surgery. Post-operatively, her recovery is pretty stormy. She ends up with an acute kidney injury, ends up on HDU, though fortunately doesn't need renal replacement therapy. She struggles on the ward for a few days with an ileus, and then she ends up discharged home with a urinary catheter in situ because she ended up in retention. The gynecology team give her a med-3 for 3 weeks and discharge her home. And 10 days post-operatively, she comes to see your practice nurse to have a removal of sutures. Another 10 days later, her med-3 is about to expire and she's on the phone. She's achy, she's sore. She thinks her wound's healing okay. She's transitioned to intermittent self-catheterization rather than having an indwelling catheter, and she has got a follow-up appointment with urogynecology the next week. She's quite tearful on the phone. She's worried about returning to work. She needs to have a nap most afternoons. She can't lift anything heavy, and she feels much weaker than ever before. Her scar is still too sore to consider doing an emergency stop. And because Lucas's school is 1.5 miles away and she's just too tired, her mum's having to do all the school runs for her. She feels like a failure as a mother. And shyly, when you ask, she's worried the surgery might have affected her future fertility, as she and James were trying for a baby before all of this happened. So I just want you to hold her in your mind as we go through the afternoon. It's probably not that unusual as a case, the sort of thing that we see on a fairly regular basis in general practice. But I just want you to kind of hang on to that and have a think about her as we go on and do some other things today. So the first task that I put for you is to watch a film. I would thoroughly recommend, you might want to have a cup of tea while you're doing this. This is going to take you about an hour. If you watch it straight through, you can feel welcome to stop and start as you go along if you'd like. But the QR code's there if you're going to want to watch on your phone or find it easier to get a link that way. Otherwise, there is a clickable link in the handout. And I want you to pause me now, go and watch that film, and then come back after the film for some further instructions. Welcome back. Good to see you. Right, task number 2. It's probably time for another cup of tea, or it might be time for a walk in the garden or a walk down the lane, wherever you are. If it's pouring with rain, I'm really sorry. You might just have to sit wherever you are to do this. I want you to have a really good think about the film that you've just watched and just think about what themes arise from that. Anything else, anything that surprised you, anything that's puzzled you, anything that you think really resonates with you as a doctor. So time to pause this video again. You've got 30 minutes to have that conversation, have a cup of tea, maybe go for a walk while you're doing it. Welcome back. Right, something a little bit more involved. And there's some nice guidelines which I think are probably going to be quite helpful to you. And I want you to spend the next 40 minutes looking at 4 different nice guidelines. The information about which ones I'm talking about are in your handout, and I would like you to produce a 1-page summary of the primary care relevant parts of each of these guidelines. Some of them are more primary care relevant than others. You may realise that with NG215, there are actually some really good simple summary documents there. And once you've reviewed those and thought about those, I don't think there's any point in you writing your own one-page summary of that guidance. But for the others, if you can produce something for your own use, for your group use, and actually to hand to your practices as well, because I suspect you'll find them pretty useful as well. So I want you to look at NG193, which is chronic pain in the over 60s, CG83, rehabilitation after critical illness in adults, NG211, rehabilitation after traumatic injury, and NG215, medicines associated with dependence or withdrawal symptoms, safe prescribing and withdrawal management for adults. You've got 40 minutes. Pause this video, get on with your task, and I'll see you in 40 minutes. Welcome back. I wonder, do you think that the COVID pandemic and the emergence of long COVID has had a really big effect altering society's expectations and understanding of convalescence? Is chronic ill health due to COVID-19 sequels reviewed differently to ME, CFS, fibromyalgia, chronic pain, or other long-term fatigue type illnesses? Are you finding yourself having more conversations about convalescence, about rehabilitation? Be interested to know what you've noticed. And I'm going to add some words from the very wise Gavin Francis here. He says, Gavin Francis is a GP, by the way, and also the author of this lovely book. He says, I often remind my patients that it's worth giving adequate time, energy, and respect to the process of healing. We need to take care over the environment in which we're attempting to heal, celebrating the importance of nature and the natural world, and recognizing the part it can play in hastening recovery. Many patients I've known over the years have found a way to make sense of even a very difficult illness journey. When an illness or disability is incurable, it can still be possible to recover in the sense of building towards a life of greater dignity and autonomy. And I suspect that now at this stage through ST3, you may well have come to the point where you have stopped viewing things within that binary context of ill and well, and recognize that there's a much bigger space in between, and recognizing your own limits as a healer, that sometimes we need to support people, encourage people, provide something that's more akin to coaching than necessarily curing people. There's often nothing to do to help people recover. And I wonder how you all feel about that. It would be really helpful to spend 10 minutes or so thinking about those questions, which I've also written on the handout, and thinking a little bit further. See you in 10 minutes. Right, welcome back for the final task of this afternoon. So I want you to think back to that case vignette and thinking about Eleanor, our self-employed landscape gardener, who's ended up having a rough time in hospital with an acute ovarian torsion, a stormy post-operative recovery, and some difficulties recovering afterwards. And I really want you to spend the last 45 minutes of the afternoon thinking about any issues that this case raises for you as a GP. On the final page of the handout, there are some thoughts and some discussion ideas, but actually I don't want you to confine yourselves to these, and it might be worth having your discussion and then going back to these points to think, have you missed any of these? Because I think it would be really useful for you to be thinking yourselves, what's going on here? What do you need to know? What are the things that you're going to find challenging about this case? At the end of your 45 minutes, your session is over. I would like it if you could produce a group summary to send into the VTS office so that we know what you've been up to today, and also a list of who was in which group for the register. I hope you've enjoyed it. If you want any further ideas for reading, study, going on from this, can I please recommend to you this book, Recovery, The Lost Art of Convalescence? Can I recommend you the work of Javi Carol, and particularly her book, Illness, The Art of Living, and also the wonderful, relatively new book by Catherine Mannix, which is called Listen. Hope you've enjoyed this afternoon. I'm really looking forward to hearing how you got on.